Hi, my name is Dr. Vanessa Ruiz, and today we're going to be talking about natural first aid remedies. If you have any questions all throughout this webinar, you can contact me at contact@nursesfornaturalhealth.org. Just a little bit about myself. I'm a naturopathic doctor. I'm a holistic nurse, a yoga teacher. My main focus is mental health. I have a few disclosures that I am a physician at the Integrated Mental Health Center. I'm also the founder of Nurses for Natural Health. And the dispensary that I'll be sharing at the very end of this workshop is I do get some proceeds out of anything that you order from there. Just a little bit about Nurses for Natural Health. Our mission is to educate nurses on the latest in natural medicine, to empower them as healers and entrepreneurs, to be able to have their own practice, to encourage them in self-care. This is even more important now than ever. We need to take care of ourselves just as well as we take care of our patients. And for more courses and events like this, please go to nursesfornaturalhealth.org. Few disclaimers that I have to share is that these therapies have not been approved by the FDA. You must know your scope of practice in your respective state. This is only for educational purposes only, doesn't constitute medical advice. I am not diagnosing, treating, or prescribing. And if there is a medical emergency, please call 911. Okay. How to create your own first aid kit. Now, as nurses, we anticipate. And including natural remedies in there can just help with confidence and empowerment, because then you have all these different choices that you can pick from. And also a lot of the remedies and the herbs are cheap and effective. And ultimately our goal is that we help heal others and then be healthier long term. So today my goal is that I can provide you with effective and different solutions for these minor emergencies. Just to share with you, this is the framework that naturopathic doctors use. It's called the therapeutic order. And the goal of it is to essentially create steps as to when to use these therapies and when not to use these therapies. So at the very bottom of this triangle is we're always establishing the foundations for health, even in acute emergencies. So if someone has, for example, a urinary tract infection, we see that that's an acute issue, but also we can see it as if that person developed the right circumstances for having a urinary tract infection, then how do we get them to prevent the next one? So always establishing the foundations for health. And then there are ways on the next one to stimulate the body's ability to heal. And that's through acupuncture, through nutrition, that's through homeopathy, all these things that get that body back into balance. And then there are therapies that we can do that help to support the weakened systems. So for example, that person with a urinary tract infection, how do we get their immune system stronger? How do we get the urinary tract stronger? And there's some great herbs that can do that. And then there's targeted natural prescriptions. So in that example of somebody having a urinary tract infection, well, some great remedies that we can do are things like D-mannose, which is found in cranberry juice. Things like uva ursi, which is an herb that can help to decrease that urinary tract infection. And then we can move up the ladder through replacement therapy, drug therapy, and surgery. So ultimately, maybe that patient needs an antibiotic. But it gives us that framework of using the least force with the best effectiveness. So the natural medicines that I'm going to be talking about are homeopathics, botanical medicines, topicals, and then foods that I can consider really as nutritional medicine. With homeopathics, this is a very particular type of medicine that's been around for several hundreds of years. And it was established in Germany by a man named Samuel Hahnemann. And essentially what he discovered was like can treat like. So essentially you're trying to match a natural substance with a clinical presentation. This is kind of different from what we're used to in nursing school, because if somebody has indigestion and they have a lot of acidity in their stomach, then we give them an antacid. However, the principle of like treating like, in some cases, that person may actually do better giving them something like apple cider vinegar, so that the body recognizes that the pH is out of balance and then decreases the pH. So another example of this would be if somebody's having insomnia, they're having trouble sleeping. And so if they're having trouble sleeping, they're feeling kind of wired and they're having heart palpitations, then this person matches the clinical presentation of somebody who has had too much caffeine. So in that case, homeopathic coffee would be helpful in matching that clinical presentation. Another instance of this would be if someone has allergies. They've got a stuffy nose, their eyes are burning, and that presentation would match similarly to homeopathic onion. It does require a lot of skill to be effective, and what I mean by a lot of skill is you have to understand the clinical presentation, and you also then have to understand the remedy and what it can produce. What's great about it, though, is that it can be effective, that it is incredibly cheap. We're talking about $8 or $9 for multiple doses. And it's portable. And then another great thing is that kids love the taste of it. As far as botanicals go, it does require also a certain amount of skill to be effective. You need to understand the pharmacology, safe dosing, how frequently to dose, and also understand if that patient is taking any medications, if there are any interactions. And it's moderately priced. Certain herbs can be about $10 all the way up to about $40 for a tincture. So it just really depends, but it's not as cheap as homeopathics. It's also great because it can be portable. And it can be pretty much found in a lot of grocery stores. It can also be found in supplement stores. However, one downside to it is the taste is kind of a crapshoot. There are certain herbs that I would not ever think about consuming in liquid form. One would be valerian root. And there are some other herbs that are really tasty, like licorice. As far as topical goes, there is a certain amount of skill to be effective, however, not nearly as much as homeopathics or botanical remedies. What's great about it is it can be cheap, it's portable, you don't have to consume it, so there's less toxicity issues and less GI issues. And GI being gastrointestinal issues. As far as nutrition is concerned, a lot of good benefits with it. They're generally safe, effective. You just have to dose a lot higher than nutritionally. So for garlic, you might want to be dosing about 4 to 5 bulbs a day if they're having an inflammatory or infection. It can take a little bit longer to act than, say, like an extract or supplement. You can find it practically anywhere. However, like the botanicals, sometimes the downside is it's not always tasty. Other things I have in my first aid kit, cell salts. So when I think of cell salts, these are basically homeopathic versions of electrolytes. So homeopathic magnesium, phosphorus, potassium. So these are great for presentation of somebody who's dehydrated, somebody who may have iron deficiency anemia. It can help to balance out electrolyte imbalances. So the homeopathic remedies we're going to be talking about is arnica, Horse Tox, Apis, Urtica, Nux vomica, and Arsenicum. For the topicals, I have castor oil, Epsom salt, calendula, cream, and gel. And for the botanicals, I have mint, lavender, and aloe. And nutritionally, I have ginger, garlic, black tea. There's a lot more than this. However, I'm just trying to keep it to minimum and what you can find very readily, what's accessible and fairly safe. And then don't forget, you want to have gauze, you want to have various size bandages, ice packs, hand sanitizer, alcohol, and also the other medications that are important, like Benadryl, Tylenol, ibuprofen, anything else that you think might be important to have in your first aid kit. And as I mentioned before, with homeopathics, the goal is to treat like with like. And with arnica, arnica is important to have on hand, especially for if you're an athlete, if there's any kind of bruising or muscle soreness, it's worse with a touch. I actually keep it in my glove compartment just because it's accessible, and I've run a lot, so having it on hand has helped me to kind of reduce the amount of medications I take. With the Materia Medica, this is kind of the Bible of what we use in terms of matching clinical presentation. And it gives us all the instances that this homeopathic would be good for. So arnica is described as bruised, sore feeling all over, from contusions or blows, hemorrhages, the result of mechanical injuries. So really think bruising and muscle soreness. Apis is another great homeopathic remedy to keep on hand, especially during the summertime. Essentially, it's derived from the bee. And with homeopathics, how they produce it is they take that natural substance and they dilute it until there's practically nothing left. And Apis works well on cellular tissue that has edema of the skin and mucous membranes. So really think hives, think about eruptions, think about urticaria. And the modalities are important with homeopathics, and they're essentially when they're helpful, when it's not, what makes it better, what makes it worse. And with this type of presentation, it's really worse with cold and better with warm applications. Whereas the next remedy we're going to talk about is urtica. It's also great for hives, but it's worse with warmth and better with cold. It can also be used for sunburn. Now, please be careful with the hives. You want to make sure that there isn't really a respiratory issue, because then they might need something much stronger, like, for example, epinephrine, or maybe getting checked out at the hospital. So please, these are only for minor issues. They're not, you have to be careful with anaphylaxis. Tox is essentially derived from poison ivy, and so the presentation is really good for a rash that has that large blister and full of serum. Also good for urticaria. And Nux vomica is another homeopathic remedy, and I'm going to share with you the clinical presentation. Pardon me. Nux vomica is another homeopathic remedy, and I'm going to share with you the clinical presentation, and you can try to guess what this would be good for. So this person is worse in the morning, oversensitive to noise, to light. They have an uncontrolled state of irritability. They may have a violent temper. And the weakness is accompanied by physical weakness and lack of balance. So actually, this remedy is good for hangovers. So Nux vomica, think the hangover remedy. But only if that presentation is similar. Arsenicum. This is a great remedy and relief. When I think of this, I think of traveler's diarrhea and gastritis, because everything burns this person. So everything burns coming down. They're very sensitive to the stomach. And when they drink water, it has to be warm, and that seems to help soothe the stomach. Talked earlier about cell salts, but one particular is magnesium phosphorica, and this is a great homeopathic, particularly for, I think, of women who are on their menses and they're doubled over in pain, and they have a hot pack, and the hot pack seems to be helpful for them. Magnesium phosphorica is also good for restless legs. As far as topicals go, I love castor oil, and I like to keep it on hand because it's really good for inflammation. It's good for kind of a lymphatic massage. And so this is topical. You can actually use castor oil orally. However, it's used for constipation, and it's only for short periods of time because it is a gastrointestinal irritant. I teach my patients to do castor oil packs, and essentially it's a way to detoxify the liver. So they would essentially put castor oil around the liver area, and then they can put a warm pack on there, or they can just wear a shirt and wear it to sleep. And that helps kind of move and metabolize things in the liver. Epsom salt is also really great for basically calming and relaxation. If you have trouble sleeping, if you're an athlete and your muscles are tense, if you have anxiety, this is a great ritual to have and do. So essentially, you put 2 cups in a tub of warm water and you soak for 20 minutes. Calendula, this is a great, you can do a gel or you can do the cream. So I think about calendula for any kind of wound, also for bug bites, can help to stimulate wound healing. However, not for deep wounds, because you don't, with deep wounds, you want it to heal from the bottom up, and with calendula, it can help to heal the top layer. So you don't want that to happen with a deep wound. Aloe has a lot of functions. It's good for sunburn, soothing the skin, and also the other part of aloe is the latex, and that can stimulate the GI tract, and it's good for constipation. Lavender, I think of migraines. So essentially placing some lavender along and massaging just like along the pressure points, like to the side of the head. And there are also ways to take it internally. However, you just want to make sure that it's specially formulated for internal use. The brand that I use is Lavella. I have no financial gain from sharing that information with you. Lavella helps with anxiety and insomnia, and it's specifically formulated orally. Peppermint tea is considered a carminative. What that means is it can help to reduce bloating, indigestion, and flatulence. And essentially what you would do is you would steep the tea nice and warm and then just take it when sip on it. As far as nutrition goes, I think about garlic and ginger. Garlic is anti-inflammatory, can also help to reduce blood pressure, also cholesterol, and in high frequent doses, it can be antimicrobial. And during states of infection, it's good to consume about 4 to 5 throughout the day. A downside to garlic is that you start to smell like garlic because it's just kind of coming out of your pores. Garlic oil can actually be used for ear infections where the tympanic membrane is intact. As far as ginger goes, I think of ginger for nausea, and it can also be helpful. There's a lot of good research for chemotherapy-induced nausea. It can help to decrease gas, bloating, and you can take it as a chew or you can take it as the tea. Lastly, in the nutrition, you can use black tea bags as a poultice, so meaning that you're applying the actual herb to that area for styes. So you'd place a warm tea bag on the area of the sty for about 10 to 15 minutes, and that can help to reduce the severity and duration of the sty. Lastly, I have put here an oral rehydration solution, and it's Celtic sea salt or Himalayan sea salt. What's great about these forms of sea salt is that it has all other different electrolytes in there, plus 1 teaspoon of sugar. You can use honey or fruit juice, also in 1 quart of water. If you're interested in starting your own kit, you can get 20% off up until July 4th, and you can get that 20% off when you go to the online dispensary at, I've listed the website there. And we have other great events coming up soon. The certificate program for restorative yoga is showing up, launching on July 6th, and that's going to be entirely online. Our goal is to kind of give nurses something that can help them to de-stress and something that they can share with their patients as well. At the end, you get a certificate, and it also is it's also available for continuing education credits. Next week, we're going to be talking about mind-body therapies, really good for people with anxiety and depression. I'm talking about psychosomatic healing. This is a particularly favorite topic of mine. The webinars are on Saturdays from 10 to 11. And if you're interested in the work that we do, please subscribe to our newsletter and also look for us on YouTube under Dr. Vanessa Ruiz. And you can email me at contact@nursesfornaturalhealth.org. Thank you, be safe, and I'll see you soon.